High blood pressure can be dangerous to your health. And while blood pressure medications help millions of people, some patients start noticing unpleasant side effects after beginning treatment. When that happens, the safest thing to do is contact your doctor or prescribing physician right away and explain what you're experiencing. But instead, some people suddenly stop taking their medication cold turkey because they feel the medicine isn't working properly. The problem is that stopping blood pressure medications suddenly, without proper medical guidance, can sometimes lead to even more serious health risks. And this doesn't only affect older adults, it can also happen to younger, otherwise healthy people. In this video, we'll break down the possible risks and effects of stopping blood pressure medication. About 100 million adults are living with high blood pressure, and that number continues to grow. What's surprising is that researchers have found many people struggle to stay consistent with their blood pressure medication. For example, a 2019 study published in the journal Hypertension tracked medication use in more than 370,000 patients under the age of 65. What researchers found was pretty concerning. About 23.5% of patients stopped taking their medication within the first 9 months. And even among those who continued treatment, many were not taking the medication consistently as prescribed. Overall, about 54% of patients either stopped treatment or were not taking their medication consistently as prescribed. And because high blood pressure usually doesn't cause obvious symptoms, some people may mistakenly think the medication is causing more problems than the condition itself. So when they experience mild side effects, they may decide to stop treatment altogether instead of talking to their doctor and finding a medication that works better for their body. Now let's take a closer look at the dangers of stopping blood pressure medication cold turkey, because when this happens, it can lead to withdrawal-like symptoms, and these can vary in severity, including blurry vision, chest pain, fatigue, headaches, irregular heartbeat, lightheadedness, rebound hypertension, rebound fluid retention, and shortness of breath. As your blood pressure becomes uncontrolled again, it may return to pre-treatment levels. And in some cases, it can rise so quickly and so severely that it leads to what doctors call a hypertensive crisis. A hypertensive crisis is when your blood pressure goes above 180/120, and it is considered a medical emergency. It also greatly increases the risk of serious complications such as blindness, heart attack, heart failure, kidney damage, and stroke. The effects of a hypertensive crisis aren't always reversible, and in some cases, it can become life-threatening. Now, if rebound hypertension does happen after stopping medication, how quickly can it occur? Well, the timing really depends on the type of medication that was stopped. For example, according to the National Library of Medicine, blood pressure may return within 2 to 4 days after suddenly stopping guanfacine, also known by the brand name Tenex. It belongs to a class of medications called central alpha agonists. However, in other cases, it can happen much faster. A case study published in Hypertension reported rebound symptoms appearing within just a few hours after stopping tizanidine, a muscle relaxant that can also lower blood pressure. That's why clear communication between patients and doctors is so important. Your doctor can help you find the right balance, a treatment plan that keeps your blood pressure under control while also minimizing side effects. Ultimately, the goal is to maintain a healthy blood pressure range while finding a medication and lifestyle plan that works for your body. And if you're thinking about stopping your medication, it's important not to quit suddenly on your own. Instead, talk to your doctor first, because they may recommend gradually tapering the medication to help your body adjust safely. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.